Welcome everyone to today's workshop, today's webinar from healthcare to health tech, career paths for clinicians in tech. I welcome everyone on behalf of IIHMR Bangalore for this very informative workshop. Let me introduce today's speakers and moderators. Today we have with us Dr. Akash Prabhune. Dr. Akash Prabhune is Associate Professor and Lead of ADMIRE Center for Advancing Digital Health at Institute of Health Management Research, IIHMR Bangalore. A health information informatician with a PhD in population health informatics, he played a vital role in launch of India's first PGDM in artificial intelligence and data science specialized for healthcare. His applied research spans AI and natural language processing for patient safety and quality monitoring, computer vision for clinical diagnostics, and machine learning models for health system optimization. Developed in partnership with organizations including NABH, Lepra India, and the Government of Karnataka. He was a member of a digital health exemplar study funded by Gates Venture and John Hopkins. The author of Health Informatics textbook and over 20 peer-reviewed publications, he is a frequent keynote speaker in harnessing AI in healthcare and public health. Welcome, sir.
Thank you, Poonam.
Yeah. Let's move on to introduce our first speaker for the day, Dr. Kalyani Kusurkar. Dr. Kalyani is a techno-functional lead and project management professional in healthcare technology with experience in digital health transformation, healthcare integrations, and AI-driven clinical workflow solutioning. Her expertise spans project management, EMR, CDSS implementations, interoperability solutions using Mirth Connect, clinical workflow optimization, and AI-enabled healthcare solutions. She works closely with clinical product and engineering teams to design and implement scalable healthcare technology solutions aligned with operational and clinical needs. Kalyani is passionate about bridging the gap between healthcare and technology through innovative solutioning, workflow automation, and collaborative digital transformation initiatives. Welcome, ma'am.
Hey, thanks. Thanks, Poonam. Thanks for the great info.
My pleasure. Let's move ahead towards our second speaker for today's webinar, Dr. Bhumika Pujashri. Dr. Bhumika come from a clinical background in dentistry and currently working as FHIR analyst intern at Happiest Mind Technologies. She has completed her BDS in 2023 and after graduation, she slowly started understanding the practical realities of dentistry in India. Like many others, she also spent months preparing for NEET MDS while gaining some clinical exposure. But during that phase, she found it difficult to accept the idea of investing so many years into education and still struggling for growth, for financial stability in the beginning, moved towards a field that aligned more with her interest and long-term growth. That journey eventually brought her to IIHMR Bangalore, where she stepped into hospital management and health IT. And since that, she has been exploring the intersection of healthcare technology. We are glad to have you with us today and we'll be eager to listen your experiences, Dr. Bhumika. We welcome you too.
Thank you, Poonam, for the introduction.
Yeah. So let's move ahead towards this very informative and exciting webinar session. I hand it over to Dr. Akash sir to take it forward. Thank you.
Thank you, Poonam, and welcome to all. Special welcome to Dr. Kalyani and Dr. Bhumika. I think hopefully I'm audible. The idea for today's webinar was that, I am personally from a dental background. The students that I have been teaching for last 4 years or maybe beyond earlier also, mostly are from clinical background. There are MBBS guys. There are a lot of dentists who actually have been asking me personally also and professionally about how can they look at other options beyond the clinical practice and uh, tech also is one of the key appealing factor for them because many of them have a relative or a friend who is doing very great in tech. And IHMR and all the students that have been working around for last 4 years, we have been working continuously on building this tech ecosystem for healthcare. The problem, or not even problem, I should not say problem, but I think the key part here was that we were not able to publicize the opportunities that the health tech presents for the clinicians. When I say clinicians, it includes a large plethora of group MBBS guys, MBDS, BHMS, Ayush guys, even physiotherapists, and many more who feel that they are getting stuck into the clinical, so they have to invest a lot for the clinical aspects to grow in that career. So was the background. The objective today is that the three speakers, all of us here, are from the clinical background. We are at a various stage of our career. Like Bhumika here is a very fresh graduate, or still she's graduating in July. She's already placed, so we call it graduate in our terms, working into a very niche area of interoperability. And I think today you will also understand what is the money that interoperability can make as a professional. Even Kalyani, she has been now uh, 3 years pass out of this of our program, and she was also one of the few students who pioneered the healthcare entrepreneurship at IIHMR Bangalore, and she has now grown into a kind of a mid-level managerial role. So this gives, and then I bring about 10 years of experience working across digital platforms. So that gives idea also how longitudinally the growth looks for clinicians who want to migrate into health tech. And that was a key idea, that you should understand what is the career pathways, how you can prepare yourself if you're interested for the career in health tech. Yes, there are some issues. I cannot say issues, but there are some drawbacks also of health tech. It's not everything is, grass is never greener, but then it always feels on the other side. So we'll have a very cordial discussion with the panel members today, and hopefully it gives all of you who are listening today, who are joined today, understanding about what exactly health tech scenario is. There's also impact that the global conditions make on it, because tech always is prioritized from as India becomes a kind of who exports tech solutions to other countries. We have primarily US based, but then there's also Australia, EU, and now we also have few other countries who actually depend on India for the tech export. So that's, I think, the idea for today's thing. And I think so that was just to set up or give you the understanding of why we are here, and how we'll spend some time. And at the end, we'll also kind of briefly tell you about the programs that IHMR Bangalore offers and how you can connect with our admissions team if you're interested in this program. So I think to start with, my first question I think would be both for Dr. Kalyani and Dr. Bhumika. You know, you both have been in this journey, and the main objective here is to kind of educate the audience on diversity of roles that are available in the health tech sector. So when a clinician thinks of tech, what happens is that you assume, or not you, we all assume it as a software development role. But then the ecosystem is so massive. So can you kind of help from your experience to break down what are the typical job roles that look like, what is a health IT consultant does, or when there's a term called as clinical data analyst, or what you can call as a fire analyst, which I think Bhumika is working around, or AI project manager. What actually is the role? And even as you are working in the industry, what is the typical day looks like? Maybe that would be, the starting point. Maybe I can start with Bhumika first, and then maybe Kalyani, you can add in.
Hi everyone. Thank you to IHMR and organizing giving this opportunity to be a part of this today webinar, and thank you all for joining today. Yeah, you're right, Akash sir. So one of the biggest conception or misconception that people have today is health tech is only a coding or software development, but in reality is a huge ecosystem. It consists of clinical knowledge, technology, data, operation, management. So all this come together. So if I take about health IT consultant, so they all mainly work with hospital and healthcare organization. So if I look into day-to-day work, that involves understanding the hospital processes or coordinating with the technical teams or implementing the software systems. So their day-to-day work or task will involve all this, and it will be surrounding ensuring the technology you actually support the patient care efficiently. And clinical data analysts, so they will work as a they work mainly on data analytics. So they will involve handling the data when it comes from patient or operational data. So they'll identify the patterns, or they'll create a dashboards using Power BI or Tableau, or that will improve the making it helps in decision making for the stakeholders of that organization. And so for example, usually we'll come across in hospital where the patient wait time is more. So they will analyze the historical data and then come with decisions how to improve those waiting times or treatment
Mhm.
outcome. So this is the major day-to-day role of clinical data analyst. If I come to my role, which is fire
Mhm.
analyst, in Happiest Mind, I can closely relate to this. So fire analyst mainly works with healthcare interoperability. So we know there is many systems like EHR, EMR systems or LIS systems or pharmacies for softwares and mobile application. So
Mhm.
all this data communicate differently. They have different formats, different structure. So how will this different systems communicate together? So this is where I mainly focus my task on. So I will involve working with fire, that is HL7 data exchange standard. So I will work with fire resources, like if some audience know about already fire, they'll come across many core fire resources like patient observation, procedure, and service request, medication statement, and so on. And I'll build fire APIs for fetching that data from fire repositories and understanding the healthcare. So this will help how clinical data moves between systems like EHR or lab or pharmacies. And coming to AI project manager, it's completely interesting today because it's not about people of project manager doesn't build AI. So AI
Mhm.
models themselves, they will coordinate between the healthcare professionals, developers, analysts, business teams, what is the business requirements, and ensure that AI solution implemented effectively in the healthcare settings. So this is what the major day-to-day work what AI project manager works. So overall, healthcare tech is exciting but not limited to one skill set. So it involves industry needs people with the bridged healthcare knowledge with technology, and they have analytical skills and problem solving.
Great. I think, the thing is that there are many terms that we have been using in health IT, like fire. It confuses the people who are not joined. So I think I will just give information of fire. So though it is called as fire, it's spelled as FHIR, and somehow it has become a de facto language. Um, so what exactly happens in healthcare is that every hospital has its own different way of collecting data. And if I look it from a very layman's perspective, what I do is that I send it in a paper with patient, he gives it to doctor, he reads, and he then processes that. But modern healthcare, or what we can call as the digital healthcare, the machines find it very difficult to understand that data or understand that kind of variation in the
Hmm.
communication. That's what we call semantic interoperability, and this is a big market. India it's very evolving, but US has invested a lot in this, and even many other insurance companies who actually have multiple clients, they need data to be in a format which can be processed uniformly, and that's where fire or FHIR comes. And it has evolved a lot. I think when we'll hear from Kalyani, she has a lot of better experience working in industry on fire. So that's, I think, the very niche area, but the payment is much more high. I think that's where I think I would go to Kalyani from here. Kalyani, I think Bhumika has really spoken about the roles, but I think one misconception is that who pays for this? Like, for example, if I'm a clinician and let's say I'm a dentist and I do extraction, I know that the patient is going to pay me 1,000 rupees or whatever money I charge because that's the service I'm doing. But this is something that is going to back office. So you can kind of, build on this and explain like what is the clientele looks like, what is the from a project manager's perspective, how a clinician is valued in healthcare IT ecosystem because the coding part and all those things, there are engineers, they can do it for a price. But why a clinician is required for many of the stakeholders, why many clients insist that someone who understands healthcare should be working in health IT. I think you are the best person who can explain with your experience working across your healthcare and across currently with your role in Apollo.
Thank you, Akash sir. First of all, welcome everyone. I am Kalyani, and I will start with the basics of hospital industry that was a few years or let's say a decade before, and what the industry has evolved into.
Hmm.
What was before? We used to go to the doctor. Doctor would write a prescription. You'd go to a medical shop and get it, and that's how your treatment would go on. Now the disease burden has increased. The patient, who is our actual end user, they are educated. The practitioners, the medical practitioners, the number in India is very low against the number of patients that they have to see, and the fast availability of a doctor, of a patient treatment, the workflow that goes beyond the clinical practice is a little higher than what it used to be before. So what happens is when a clinician puts down his requirement, the engineer is supposed to pick it up. But in between, there is no gap. There is a huge gap. And there has to be a person who understands the gap, who can fill the gap using their expertise, and then go beyond his scope or beyond the technical understanding of it and become a techno functional bridge between these two requirements and the how they have to fill it up, and then they can deliver it on the ground. And this is not just one hospital's need. These are there are enterprises who will be looking for personnels who can understand technical as well as the hospital industry. And this is what is this is where even I get a feedback that if you have like people like us, like there are multiple people in my industry as well right now, like Akash sir said that there are a lot of dentists who are coming to this field looking for a future. And I would really proudly say that as a dentist you have or as any medical professional for that matter, you invest a lot in medical field, but there is a gap that we have to fill just to cater to the other medical side of our colleagues of fraternity and connect them to the users as well as the backend team, and then come across a lot of new technologies. That gap we have to fill. Apart from that, I think second question that was asked to me was about FHIR and the the quality of pay, who is paying, and who is at the back end. So FHIR is the infrastructure that even India we have it as a mandatory stack now, that we have to migrate all the healthcare systems will have to migrate from the current stack that they're using to something called as FHIR, which is fast healthcare interoperability resources. And in that there are a lot of concepts. So, if anyone who wants to understand, there are a lot of concepts where FHIR needs to have a clinical domain knowledge. So, if any one of you who wants to understand what it is, just go to FHIR, go to their website, pick any resource, and see what the definitions are. If you have clinical background understanding, you will be able to understand it better. And then coding is very easy these days. With a lot of AI things that are coming up, you can learn it in 1 or 2 months, and then you can go ahead with that. But understanding the core concepts is something that will come very easy to someone who is from the clinical background.
Yeah, I think what my experience has been, and maybe yeah, that is like 10 years in thing. When I started working in health IT, it was even called as what we call as the e-health or m-health. And there was a very clear differentiation that the clinical guys will not code, they will do maybe implementation and training, and there will be engineers who will do the coding. But now what has happened is that there is more openness to expect that yes, a clinical guy can also do the coding. And when I say coding for a context here is that it's not the hardcore C++ coding, it's more of what we call as the functional coding. Basically it involves like I'll give an example. Say that you are running a hospital, and today what happens is that when you're running a hospital and at the end of month you want to understand how much patients you have done, and say each department wise how much is the ROI, like you have spent say X amount of money on hiring a doctor, hiring a nurse and all those things, and how you want to estimate that how much you have gained at each of the month. Now what you do is that you will go to Excel, you will pull down all those details and start working on that. If you do the same thing on Power BI, you have to do it only once, where there is less of coding, it's more of a drag and drop. But yes, it needs us little efforts to understand how to operate Power BI. And then you can do it month on month just by copying the Excel sheet or and pressing into your Power BI app. So that's where the life has become much easier from the coding perspective. It's the five coding tools that we use in health IT is mostly what uh, Excel becomes a standard. Then we have Python. To some extent, I think we go into the SQL, which is somehow AI is kind of breaking out the barriers there. Now there's a lot of push for unstructured data into healthcare. But yes, then SQL is still the major one. And then you go for obviously Power BI or any visualization tool. And others are very easier now. Once you start working on the Python also basically you will be able to understand how to use React.js if you want to build a front line. Now Claude does everything for us. So I think coding, I think that's where I think I wanted to come to Bhumika, because you have just entered and you're fresher. And many of them have uh, this fear that will I be able to sustain, will I be able to get a job, like how will the industry react, a dentist joining this thing. So what is your experience? How was your experience with so-called coding? Because I remember I remember for my earlier bachelor study, we used to have a bit of struggle when we started the open EMR also, and also the fire, the thing. So how did you overcome your fear of coding, or say when you were in your second year?
Mm. Okay. So fire, first of all, fire is not sounds like very technical, but it is simpler term is it's a common language for digital. It's a common digital language. So here it doesn't requires hard coding as said by Arun sir. So in my experience working in as fire analyst, I only use JSON coding, and that too minimum, like for my transformation logic I will use fire.json for posting it in server or to fetch the data and all in real time. So coming to fire will stands as fast healthcare interoperability resources, as a simple term. So fast is nothing but is quicker and easy data exchange, and in healthcare is the healthcare data. And interoperability means, as I already mentioned, it helps in communicating between different systems, right? So it is called interoperability. And resources is a, again, it's a small pieces of data, like patient information, demographics, or procedure or therapy plan. All this comes as a small pieces of data, so that's why it's called the resources. That's how the HL7 organization has come up with fire standard. And usually in my work we use R4 version, that is release R4, that is the latest and approved version of fire. And coming to fire analyst role, if I have to give a complete life cycle how I work with fire data, as usual we use a vendor software, where the data will be populated when the patient comes, admits, or creates an appointment or creates an encounter. And if there is a OPD patient, the process is different. If it is IPD patient or if it is a daycare procedure, then the workflow will be different. So whatever the workflow, we will populate the data in the software where we are using, and then we will transform the data into JSON, and then we will map the data using HL7 fire standard. We will that requires that step requires a main domain knowledge, I think. So without the knowledge we will not able to understand what data goes to which resource in fire, that is FHIR. So after that mapping, we need to create a JSON. That JSON is human readable JSON, so it's not a very hard coding. Anybody with it's a basic structure we follow. It's not so hard. And then after the JSONs, we will push that the JSON to the Fire, where we follow a repo, I mean the database. And then that is ensuring that the call action, that API call action, works efficiently whenever the data has to be fetched. So this system, this ensure the system exchange information meaningfully, as Akasar mentioned, the semantic interoperability, and also in a structured format. So this is what it's now we all know that the digital health is rapidly growing. So everybody is going to digital version, and where EHR is raising up. So this Fire or interoperability is becoming very high in demand. So every technology has to depend on accurate and standardized data. It cannot be a wrong data, or it cannot be a wrong information. So every time when the doctor has to make a decision, the data should be accurate. Like for clinical decision support system, CDSS, it's very important data should be accurate. So here Fire plays high demand. And it's not, as I said, it's not a hardcore programming thing. It's very easy. Only thing, we need to have a interest and passion, and always ready to learn, adaptability, and have some analytical skills as well.
Yeah, I think you went too much deep detail into what was expected. That's cool. But I think, yeah, no. Uh, did you like one thing that you can tell in one line or something is that how did you overcome your fear of coding, like as a dentist and when you were in second year of health IT? What you I think all students are afraid. Even I'm afraid when I started. So how did you overcome that fear?
So, starting from curriculum, we had small exposure to Python, SQL, database, NoSQL, and all. But apart from that, I also started have a self learning, doing small certifications, and then understanding first basic, shortcuts, how to remember, how to learn. I know it's for a medical background person to learn to one Python or C++ is completely not possible. But I was aligning what is required from industry perspective. Like no company, as for a fresher, will not expect to know all technical skills. They will just think that they should be knowing basic things, a few things which is more relevant. So I was only focusing on few skills, and then eventually I started learning and adapting to what business required in the task I had.
Great, great. I think yeah, this should help. Because I think what I tell all my students is that it's just effort to start, and once you start, you need to stick on that maybe for 2 3 weeks. We have this formula of do something for 21 days and becomes a habit. So if you enter that and you can do it for 21 days, try different ways, and it would stick with you. Yes, the industry knows that you're a fresher, you're from clinical side, so they also kind of discount that factor. I think this is where I think I will again go back to Kalyani. You have been in industry, you have seen these things, and how hard it was for you to move from a fresher to middle management level in span of 2 years. Against whom you are competing? Was your competition against the clinicians or the engineers, or how was the corporate environment? Were they welcoming? Were they accepting that, oh, this doctor is now going to kind of guide us? Or how was your overall team experience working in the industry?
Sure. So I will start with first my internship with IIHMR Bangalore. I'll always be forever grateful to the internship that I had with Arun sir, from where I understood the value of HL7, FHIR, and all the healthcare IT terminologies or verbiage that we are using right now in the meeting, which can be very overwhelming for all of those who are very fresh to the industry. So to them, I'll start with one thing, that as a dentist, I did not even know how to create advanced level Excel sheet. I knew how to open it, how to read it, and how to close it. That's all. So everything I learned in IIHMR Bangalore, with all the courses that we had. And for coding, like Akash sir said, SQL, basic level of Python, basic level of JSON. If you can, spend at least an hour or two for next 2 hours, for next 2 months, let's say, or next 6 months, you'll be able to understand the basic level of coding. What is coding? First, understand this. Coding is nothing but a backend logic that you're teaching a computer how to, coordinate with whatever requirement that you're put forth. If your logic is clear in your head, then your coding becomes very easy. Same goes for SQL. It's like a language. If you want to if you want to query some data in from a database, so database is a place where every data gets filled in based on the parameters that we have. For example, you have a registration form, in that you have patient name, age, sex, and everything. So that every field will go to a database and it gets saved into it. If you want to get that data, you need to just know the logic that, okay, I have a OPD patient. So based on that OPD number, I will get this data set. So to understand that, maybe it took me, let's say, 8 or 10 days to understand what SQL was. You have some time before you go into an internship, or before you reach a point where you have to go for an internship. You can do it proactively, and then coding becomes very easy. As for my experience goes, I was very fortunate to get into a lot of good opportunities, starting from my internship. Then my next job, I took it as a project manager, which turned out to be same like how Bhumika is doing right now. I was also an analyst for doing FHIR, HL7, and a lot of API integrations, as a coder as well as the manager. But now that I am here where I am right now, I think what mattered the most, or what matters the most, is that you understand it clinically. You have very clear understanding of what someone is asking, what you have to cater. And then coding, and understand coding a little, because see, if you have to work with a developer, then you have to talk to him in his language. That is something that you have to do. If you don't do that, they're going to fool you. And then as a manager, especially as a mid manager,
That's true.
where you're sandwiched between the lower and the upper stream,
Mhm.
you need to understand both of them, what they are talking. But that content comes very naturally if you have clinical practice as your background. If you can confidently say that, okay, I'm a doctor, I understand my clinicals very well, and I understand this, I'm learning my technical background, but I understand what you're saying. And then you get into gathering those requirements and then catering to the needs of your organization, and you're solving one problem a day. Then your value becomes too well. And I just want to, randomly put forth this question to the 72 participants right now. How many of you think that coding is actually very important when you have to transition into healthcare IT? Just as, my curiosity, I want to know, because I came from the same mindset, but now my mindset has completely changed. But just as a, you know, some tension breaker, how many of you think that it is necessary?
Yeah, I think they can reply in chat also if they don't
They
want
can
to
just
speak.
give me a thumbs up, and I will understand that, okay, so many people think that oh, see, so
So
many.
many, so many things.
It's not. Trust me, it's not. You can understand very, very basics of it. You can just understand what a coder has to do. Then Claude will take care of everything. Trust me. You just have to understand what the developer's language is, and then you're through. That's not an issue.
I think, yeah, though this vibe coding culture has really made life easier, but also the competition has been more harder now. The only saving grace for us as clinicians is that however you can vibe code, Claude or anyone still makes mistakes when it comes to medical knowledge. So that's where I think our jobs somehow are still safe. I cannot say it will remain forever because the the AI is becoming smarter than us for they already
Yeah,
have
but
medical
see,
models.
same. I would, what I would say is, even I am facing the same challenges, that I gave a developer to develop an API, and he'll come back in 2 days with an API. But when API is some, the strings that you see on your web browsers, right? Similar way, we have
Mm,
some URLs that we fetch the data from.
mm.
So when they come back, to stitch it back to the workflow, how exactly the workflow will look like on the ground, what are the positive scenarios, what are the negative scenarios, how are the
Mhm.
test cases designed. These are the attributes that the AI cannot do. It will give you suggestions, very good suggestions, but the actual human factor is still missing. And as clinicians into health IT, we can fill the gap. So instead of competing with the engineers by learning coding, what we can do is apply our knowledge with basic understanding of engineering, and then you are a niche person with a techno functional understanding of all the features of healthcare. And like I was talking to one of my colleagues the other day that when I was entering the healthcare IT stream, I understood only HL7 and FHR because that was my gateway to get into the system. I thought that's it, this is what everyone does day in and day out. And now that I'm going in and in, the more I'm exploring, I think there are so many jobs available. To name a few, there are some jobs called as business analysts who will take the requirement from the doctors, understand what it is, understand very basics of the technologies, draft the documents, and then share it with the developer. I think this is the very basic job a dentist or any medical professional can get into, and it doesn't need any sort of prior experience for to get into such roles. You just have to understand the basics of IT, and you have to demonstrate your strong clinical background, and then you can get into those roles. I think that would be a great
Correct.
starting.
No, I think as you have mentioned about the job roles, I think we can also emphasize that not all health IT roles require coding. For same thing, business analyst or BA role, what we have, most of the time it's talking to the doctor, talking to the nurse, understanding their requirements, putting it in a, again, it's a Word document basically, or any kind of document, but writing it in a way that a developer can understand or read it. That's the only thing required. What we call it as a PRDs, project requirement documents, and maybe BRDs if we have that cases, or that's again business requirement document. That's the thing where there's also a lot of work that needs only a domain expert to come in. Somehow, what has happened is that the healthcare guys always feel that health IT means coding, and that stuck has kind of created this vacuum. We have many kiddos who are very good in coding, but then they prefer to go as a BA, business analyst, because that was much more easier for them to kind of work on. They felt more comfortable doing that role. And mind you, talking to a doctor, and this is where I think again I'll go to Kalyani, is like, where is exactly the opportunities, like US healthcare is one paradigm where from long, I think, I don't know, from past 7 8 years we've been relying on US healthcare for the revenue into health tech or even tech as a longer. And then we also saw Indian tech evolving. Now Apollo, I think, when where you are working, it's also growing its own homegrown ecosystem. So looking forward next 5 10 years, where would be a massive opportunity coming in? Will Indian health IT ecosystems be able to sustain the salaries and all things that were offered from the US? Because many of our students, sorry, so, yeah, many of our students go to Tech Mahindra because the US exposure is important for them. Uh, Even the internship that we give, they prefer that let's go to a US company. But again, the jobs are different, the timings are different. So how you foresee this ecosystem evolving in next 5 years or so? Where is India playing role? And how the current market with the global scenario going around, uh, you can just give them idea, like if someone is planning to join today as a program, as a PGDM, or in health IT, or even in AI data science, what should they look like for their career to grow?
Okay, so I'll start with first the US industry. So, in my experience, I have worked with European companies, with Malafi, which is UAE and Arabs, and then US as well. And now I'm working for Indian Health Tech. So the problem that I will give you both pros and cons. With US comes a lot of money. The jobs offer
Hmm.
you, the salaries are really, really good, but the timings are very, very bad if you are in a customer facing role, which as clinicians, we will have to do a customer facing role because that is what is the most, best role that fits for us. So in that case, the shifts are according to US, and then you'll have to do that. Apart from that, apart from so pros of US healthcare is the established systems, lot of workflows you can learn, and since all the other countries are growing, you can learn that as a standard and then implement it to the US. the other countries. That is for US healthcare. But the biggest cons, of US healthcare is it is stable now. Most of their healthcare organizations have adopted to the digital infrastructure, and they don't have any innovative jobs left. So any day if automation comes, it is going to hit healthcare industry jobs in the US market.
That's true.
Coming to European countries, they have implemented FHR, most of them, even for UAE. Malafi is based on FHR as well as HL7. So there is lot of growth opportunities in those countries. The timings are good. So if you understand all these technologies better, then you can go into European or the UAE countries as well. Coming back to India, the biggest difference that I found here was the healthcare need is immense in India. Immense. When I say immense, we are overworked, we are overburdened to find solutions. And even when I was working previously, in my previous roles as well, when I was working for Indian clients, this was the major difference that I would find, that the other clients would not ask you for very strict timelines, but Indians would, because the pressure is immense here. So there was a company called Data Interrupts where I was working before, and the major thing that you can do here is clinical solutioning. So there is something called as clinical decision support system. You can all go and search this. So when a patient walks in and a practitioner has to do some diagnosis, or there are a lot of varieties. When a patient is getting discharged, they'll have to create a lot of documentation. When a patient is getting transferred, there are a lot of workflows that are present currently, and the workforce is very little. So how to automate those workflows, how to bring AI into writing your notes, AI into helping you with the clinician decision support system, how to utilize your own databases for the predictive analysis, how to track your patient journey, how Dr. Bhumika said, right, that the waiting time issue that every hospital has, how to do those. These are the gap points that some startups are there. They're trying to fill these up. There are a lot of startups that are coming up with so take one problem statement at each hospital, take it proactively, take one problem each, and then find how many people are looking for the solutions, and the number required versus what is available is, there is a huge difference. There are a lot of solutioning that is still not there in the market, which has to be there, and that can be filled by clinicians, is my strong belief. That there is a lot of, like I said, clinical decision support or AI predictive tools, AI help in the EMR, within the EMR if you have some AI tools. These are all the problem statements that are there, and there are a lot of companies who are already working on it. But if you can be one of them proactively, then yeah, we can solve this problem.
Yeah, I think this was really a good way of explaining, because I think money lies in a very stable system. Like for US, they have built the entire thing on the insurance as a payer, so that's where there is a clear indication who will pay. In India, the problem is that we have a very mixed system. So even if I build a health tech startup and I want to employ few people, my revenue is very much dependent on a lot of factors which are not accounted for. So I think as we evolve, the opportunities will grow also in India. But I think as a fresher, I still recommend students to first look at the US opportunity, because that feeds your home. So that's the thing what to start with. And then as you grow, you can then find a good niche company which is solving a very critical problem in healthcare using tech in India, and then you can invest. That would be a better role, but it takes a lot of time and thinking around. I think yeah, we are at the very tail end of this discussion. I think I would circle back to Bhumika. Bhumika, can you kind of list out the skills that, or maybe we can just 5 skills that any clinician who wants to join a health tech company should learn to find a good job or good opening?
Okay, I feel there is few important skills like basic Excel, as already uh, Kalyani ma'am already mentioned. So for us as a clinician, we know only to view the Excel, but we need to know till advanced, because we need to handle lot of data in healthcare, like it and also the basics of SQL and Power BI and analytics, mainly data analytics, and also few a few softwares. Basically, if nowadays, if you're going to software based companies, right, software service companies, mainly they works on agile methodology. So we should be knowing few softwares like Jira, and also from technology perspective, we need to know few softwares like Postman, VS Code, and DVBird. All these softwares will help us to enhance our knowledge and work, grow in our career as well.
And how much of that kind of, um, were taught to during in your program? Because I think, uh,
I didn't get you, sir.
no,
Pardon?
how much of these skills really you learn from your program, and how much of this has to be
Yes,
learned
in
by
program,
self-study?
yes, in program, obviously we will learn SQL, Power BI. 50% we would have learned here only. So other 50% we will bridge that learning from industry exposure
Mm.
also.
I think, yeah, that's great. And I think, again, going back to Kalyani, many dentists or many clinicians who are interested to join kind of the health tech journey or to find a jobs in health tech journey. What are the pathways that you think are good for them? For example, I think we had many of the dentists we spoke during the IDA conference. They were doing MDS, they were doing MDS in oral path, and they were saying, uh, we tried vibe coding, we built up our own solutions. One girl was really good who built uh, a AI-based, what I can call as the software, which would read the pathology slides for squamous cell carcinoma. And now the thing was that I have the skills. How can I get placed in industry? So, what do you think are the ways to join the industry? One obviously would be, if they are doing a self-learning, is that the best way? Or, again, you can comment on that. Even Bhumika also can comment on that. Or is there a institutional way is the best way? And what are the options? Should they do it from India? Should they do it from outside? Or what is the things that they can work around?
Okay, I will start first. So first is in my experience, I think 2020 was my life. I will just give my short example and then we can move on.
Hmm.
So I have about 7 years of experience before I moved my careers. And 2020 was the deciding year when COVID was there and dentistry became very risky suddenly. For the
Hmm.
pay that we were getting, the dentistry was not worth the struggle that COVID was asking us to do. So that is the time when I decided to move my careers. I tried from my own way for 7 to 8 months and I couldn't get into any place. Maybe because of 2020, where every job was getting hit and no one was getting placed. But even in the start of 2021, mid of 2021, I was not getting anything. That is the time when I found IIHMR Bangalore. I got into the course and institutionally I was able to get lot of internship, lot of opportunities. What I wanted to do was do health hospital management, but rather I was shifted. I was actually, holding hands. I was brought into healthcare IT, and I was able to cross my ways. And then now that I look back, I understand that of course, hospital management is a great industry, but this is also one option that I was never looking for. And going from having it, searching personally or by my own to having to do it institutionally has helped me a lot. So I would ask anyone who asks me how do I do it, it would be through institutions, because you will have alumni support, you will have your peers, same set of mindset with people, lot of learning, and that is a better and easier way to do. So that is my first answer.
Hmm.
Second is, I think, about the question. Could you please repeat the second question? uh,
No, would be beneficial if you do this program or do some kind of program from a foreign university rather than doing from India, or an online program would be better, or an offline program would be better.
Okay, so I have my own views about offline programs and online programs, because even that I have seen. I have colleagues who has done the very fancy advertisements that you get on the Instagram. It doesn't help. It doesn't help. It doesn't take you anywhere, because ultimately your recruiter will see where you have studied from, and if it's a online course, the value has already depreciated unless you have a very good experience in that field. Okay, so if you've already been there for last 7 8 years and then you have such credentials, then it makes a difference.
Hmm.
But if you're a fresher, then going through colleges would help.
my take on foreign institutions is a little different, because as dentists we have already invested so much into our, unless you are from a government college, you have invested a lot in your bachelor life or bachelor graduation. In that case, I don't know how much spending is worth to go into a foreign country and then learn. And also, US will pay you really well if you go there, but getting into healthcare jobs, if I'm not wrong, is very difficult in healthcare as well, in US as well. It's easier to get US jobs from India than going to
Mm.
actually having to go to US and get the jobs there by doing their courses. And then the curriculum, if you want to go to foreign country and then get a job, would be very different. The curriculum would be a more of a master's degree with very niche medical informatics as a course, and then you can probably land into a job. But I have few colleagues who've come back from US because they couldn't find the job, and they're doing the same thing that I am doing today. So it's really your luck in that case, how it the things will fold around, or what will happen in the future.
Yeah, I think what I would say on my personal experience was that when I did my master's, I did from India and it was completely into pharma industry. Somehow I was thrown into the health IT. It was never the role that I had chosen. And what we kind of, learned, it was very early era, was that the the placement of health IT professional is very difficult because there are too many terms: health informatics, digital health. Now digital health has become much more popular than health IT. And the thing is that industry doesn't mind whatever tag you carry. If you are able to do the work, they 90% chance they would accept you or they will hire you there, because this is what both of you would have also seen. Like, they don't worry your dentist or doctor. If you can get the work done, they are happy for that part. But then what colleges or institutions like IHMR support you is that connecting the right people. I think Arun came through IHMR's contact, and I think you, Kalyani, was the first batch who went for the fire. Even if I can put it statement here, it will be very kind of obvious. But then in India, I think only IHMR Bangalore offers fire programs or fire in teaching. There is no other colleges who offer FHIR as a part of curriculum, because it's very very costly, and also it requires a faculty who knows these things and teach. And there are only a handful of people who really work in fire and can teach, because either they're too busy doing you all have met Arun, you have met the client, they're too busy with the clients, the money is flowing for them. The budget for companies for finalists approximately 25 lakhs today per annum, so they don't care about teaching. So it's really difficult to find a faculty who can do this thing, spend time and teaching. So I guess the best way if someone wants to enter health IT is find a full-time program. A 2 years full-time program is much better than a 1 year, because it also takes some kind of efforts to build your profile. I think uh, uh, what Kalyani gained her edge was her internship, which she started in the first year. And then I think that turned out to be a game changer for her for the placement. Same for Bhumika, because she started working into third semester, and then I think the placement season started. And so the steel industry is smaller and it's very close, so it's very difficult for someone who is self-trained or who is doing it online without placement support to really get that connect and start getting placed. And this market, where it's very crowded, the resumes are very same. Like, I have been looking at resumes, and I think Kalan were doing, all look same. Many students or many people who go, they write they have so many skills, but then the skills are not really seen in their practice. So I think that's where it's essential for anyone who is working into or who is planning to shift into health IT, spend some time, maybe research, see what are the options available. um, the good thing is that if you're in South India, Maharashtra, and the region, Bangalore itself is a city which hires a lot of health tech or absorbs a lot of things. So that benefit also comes from this geography that you have. I guess we are in the very end. Before I open for the questions, we think we'll have few questions taking. Um, any message that both of you want to give to the dentist or any clinical professionals, maybe basically anyone, like, should they enter health IT, and what should they take away from this today's discussion?
I will start first. So, as both of them, Akash sir and Kalani ma'am said, when you're transitioning to new domain, right, specialization certificate is very important. So that will give us the foundation understanding and shows the recruiter that you have taken some initiative to learn beyond an academics. So again, my advice for freshers would be, don't wait to become perfect before starting. Like, explore different areas, build practical exposure, do lot of projects like AI project or AI chatbot projects like that. Show up in your LinkedIn and stay consistent with learning. So this will open up more opportunities to for them.
Great. Thanks, Bhumika. Yeah. Yeah, Kalani, if you want to give
Yes.
them some message.
Yes. So I see. I was just going through the chat window. There are a lot of questions about IHMR Bangalore and the courses around. So yeah, it can be very overwhelming because everyone, you feel that I'm losing my doctor degree, my name will not be utilized. That how much I have studied, it is all in vain. Will I know the coding and all? These questions will be there forever. Even if you stay, you will have the question, why didn't I change, and why didn't I go into some field which was upcoming? So my take, or these, to sum up the call, in a gist, is that yes, you have to understand a little technology. How you were studying your anatomy, same way you may have to start a little, learn some basic skills. This is everywhere. Even if you stay in dentistry, you'll have to, or any other field, medical thing that you are in, you will have to keep upgrading yourself. Consider this as an opportunity, upgrade yourself. Once you do that, there are a lot of opportunities that are out there in India. Lot of consultants come back to us who are good, like they are very huge names in Indian industry. They come back to us and they really have the understanding of IT, even when they have that much stricter schedule that they have. Even then they have solutions that they want, and that the market will open in India as well as the foreign countries. But it's just that our workforce should be ready, and this is a great opportunity where you can start. Spending 2 hours a day on new technology or new skill will help. It helped me, it will help everyone. So if you take that as a starting point, and you go to good institutions such as IHMR Bangalore, you can definitely crack the industry. And the starting packages will be low, but then the growth is really good. You can, with 2 or 3 jobs, you will arrive at a level where your engineer friends from your own peer groups are earning. You will be able to do that, and then you can always look for great leadership roles into in the the industry, and that's a good way to go.
I think thank you, Kalani. Thank you, Bhumika, for this great discussion. We have few questions. I think let us see. I think Zahara is asking, is there a difference between MBBS doctors, dentists, physios, pharma grads, or is this a fresh slate? Mm, yeah, I think there is not much difference when you join health IT. And I think I'm taking answer. If anyone wants, you can answer. But they don't discriminate saying you're MBBS or something or BDS. Usually things are okay if you are able to demonstrate that you can do things. Yes, there is slight preference for MBBS guys for two reasons. Is that if there is something that is too much into the statutory, like serious score or things is coming, then MBBS guys are preferred. Otherwise, else there is a very level playing field and anyone can work around that. Which roles are high paying? I think this is by Shweta. Maybe anyone wants to take this?
Yeah, high paying roles would be the managerial roles itself, because developers you cannot compete with. I tried that. I tried to be a developer,
Mhm.
but then the job competition is way too high. So when I
Mm.
moved into management, which is our core curriculum as well, so with IHMA degree, I was able to demonstrate that okay, I have a certification as well. That would be a great role. You get paid as well as there is no stress as much as the developers.
Great. I think see the payment actually differs from context to context. Sometimes someone wants work from home, so there's a different pay grade. Someone's looking for a US job, so there's a different pay grade. Someone's looking for Indian jobs only. There's a different way of someone wants to work from their hometown also. So that differs. But on average, we have seen 7 lakhs, 9 lakhs as a good starting package. Where I thought that was good because that's how you enter. Remember, that you are entering a territory of a different group altogether, and people don't, you know overtly start paying because you are coming with a fancy degree. They want to see the results. So that is one part on that. I guess, yeah, the can CAT is happening only in November if I join. So I think what IHMR has is that CAT scores can be submitted by the, I think, within 1 year of starting program. So even if you are joining the program, you can apply and submit the CAT scores by the end of your first year. That I think that is available. And you can talk with our admissions team. They'll help you to understand this process. How is job market? Is it saturated? I think anyone, Bhumika or Kalyani, who want to answer? I think Bhumika, you can take the answer since you're
Yes.
entering the job market at this point.
No, I don't think the job market is saturated. They are looking for skilled professionals still, but they, as Akash has said, they are looking for results, not just the fancy degree or what is the degree you're holding. They look for your skill set, whether you're able to or understand their requirement or they're able to work. So it's not saturated. So there is many opportunity, many roles opening because of AI, because of interop, or if because of digital health.
Yeah. Okay. Amita has some questions, but she has. Yeah, Amita, you can list out the questions. We'll be happy to take it. Okay. Practicing you're a BMS doctor. I think, yeah, for BMS also we have many students who were BMS and they have been placed well. Even our current batch of AIDs has two BMS students, and they're doing fantastically well in the. Actually, there is a lot of money coming from Indian government for BMS grads to work into AI. The Minister of Arts is spending a lot of money. A lot of projects are coming. But then industry also pays you much better. They don't worry about being a BMS doctor or a doctor. They are, if you do this technically well, we have to speak to a doctor. So he can be BMS, he can be MBBS. The answer is the same. So that will not have any difference. Future of options of doing this, I have done BDS. Again, same thing. You have options of hospital management, health IT management, AI data science. Whatever you prefer, health IT is one segment. You can start like what Kalani said. You can start as analyst, or you can start as a that can be BH business analyst or a market analyst or any role, and then you can go into a mid-level management. And then after 5 7 years, we have seen our students who are alumni have become a kind of upper level management, and that is what I think we have been seeing. There is some question in terms of what are challenges we'll face as beginner entering to this field. AIDs, I think the biggest challenge students have been telling us is the first semester is very intense. And I accept that because they have to go rigorously through the mathematics that is required for machine learning. We do bring it down that a doctor can understand. Even our faculty is also filled with doctors, MBBS guys, BDS guys. But yes, the first 6 months are very much painstaking. There are a lot of efforts you need to put. The good thing is that by the end of your first year, you'll go for industry internship and they will understand the value of those things. So it's not that it's happening in vain. And at this point, our batch, which is of 11 students of AIDS, all of them are placed in industry with stipend. One of the guys actually getting around 1 lakh for 3 months, and that to train an LM. So their roles are plenty. The good thing, healthcare somehow is still the area where you cannot move ahead without domain expertise. So that is the benefit that you get shifting from your core to this kind of thing. Um, okay, Amita, if you want to talk on mic, I guess, yeah, please do it. I just have two questions and I will ask you to
Yeah,
speak.
hi. So this is Amit. So
Okay,
first,
yeah.
I mean, thank you for recognizing. So basically, I had two or three questions. First thing is like, how is it different, if as compared to somebody who's doing mainstream data analytics or AI? First thing.
Mm-hmm,
Secondly, when it comes to tools or databases, there is no dearth of them. Like
mm,
SAS programming and all. I mean, it's really infinite. If you go on learning, there are a lot of them. Okay.
mm.
So how is it, if somebody has, what we can say, learned SAS programming or something, or I mean, how do these differ, first of all? And the third question is that, well, like, you mentioned that there are multiple roles that are available. So is it a possibility to get a part-time or you can say a project-based role or something like that? So these are my three questions. Thank you.
Okay. I think Kalyan, you can want to take about the SAS question, maybe.
The last question I can answer,
Yeah.
which is about if you can get a part-time job role. So I think first year it is not allowed to do a. If you are into IHMR, first year you'll have to continuously take your jobs. But in the second year after internship, I got into a job role, which was it was a startup company, and I was able to do the job. So yeah, that you can do. Getting a part-time role with what skill set you are saying, like you need to have a skill set to demonstrate that okay, I have this understanding of the industry, and then if you can get into any role, then probably it is easy for you to get. But apart from that, I don't think that you should, because first you have to focus on your getting your skill set. As for the data, AI and DA scores that you are talking about, so I also sometimes I have to work with the data analytics team, because we have to do some ground level analysis of the adoption percentage, what are the gaps in the in the hospital industry and all. So in that place, defining the logic is something that you have to do as a clinician. So that is the place I think this AI and the data analytics courses will come very handy if you have the understanding of it. Because I had to learn Power BI again, I learned it on the job, and not in. I think when I was studying, it was not a part of IHMR curriculum that
Mhm.
time. Maybe introduced later, but I had to learn it in the hard way. But it is mandatory that you have to have these understandings as well. I think I have answered two of your questions. Which question
Correct.
I missed?
I
I
think
missed one
the question
question.
he wanted was regarding the SaaS thing. I think, see, the tools are many. Remember, the industry is filled with so many SaaS tools. The problem is that the principle underlying these tools remains kind of same. You talk to the client, you get the requirements mapped. The map requirements are turned into a functional product, or what we call as the high fidelity prototype that is tested. Testing is completed, testing successful, and then you get the product working and you get paid for that. So each SaaS has same story there, but then people are required to manage the projects. People are required to talk and translate those needs properly. If I look from the agile perspective, as a company, it costs me to run one agile cycle, like where I get from a development to product or prototype, what you call it, and show it to my customer, get his approval, and move on. So if there are many changes in my product, that means my requirement mapping was very bad. So in healthcare, this is a bigger problem. Many companies actually face the same issue, because if the requirement writing was not done well, or there is sudden changes, I have to again put my developers on work hours to get this done. So what they have been also looking at as an industry is that let me get someone who can really do this work from a domain perspective, so I can have minimal changes in my agile cycles. And that one, so products are many, you can learn as many things. The core remains same, the Excel, SQL, Python, all those things. Other things you can learn once you are in industry and the job requires you to do it. Many a times the company itself trains you on those things because they understand that it's a very niche technology and they need to put some effort. So that's how things work from industry. I think, Amit, have we answered all your questions?
Yeah, thanks a lot. So, what you talked about additionally, licensing is something that, we're
Hmm.
actively doing as a part of our job, right?
Correct, correct. A lot actually. Even hospitals have roles like analyst, and they also want like someone who knows IT to talk with their IT team, because it's always a conflict between IT team in a hospital and a doctor there. Okay, I think yeah. I think if any other questions anyone has, you can connect to our team. We have the number displayed here, or you can also write to me or the marketing team. They will be happy to respond. Um, the course duration for HMR is 2 years, and usually I think it's um, last, I don't know, Diwali of the second year when you start applying for jobs. That's where the placements open for all of them. And place specialization thing would be mostly in terms of like it's open to everyone. You can choose whichever you prefer. You talk with the faculty, you talk with your peers, and you can look at your interests, and then you can choose specialization. AIDS is not a special; it's a course in itself. There is no specialization option. But HIT is a specialization in health and hospital management. The course is not online; it's an offline course. We preferably keep it offline because studying there in a campus with the peers and with faculty when you're learning new program is really important. Or else placement becomes a lot of complex thing, and um, that's why we prefer to keep it offline only. The internship payment, I think, what you can do, you can check with our placement teams. They differ from, minimum is something around 10-15K per month, goes up to 35-45K. But internship is for 3 months. Um, you have to again come back for the campus for another semester, and then you start looking at the jobs. Um, the same thing. If you want to apply for jobs in the program, it's approximately after the third term is ending. That's like if you're joining for this year, 2026, 2027, October, November, when the placement season will start. That's what I think we have. I guess, yeah. The course is 2 years, yeah. Okay, I think questions you can send it to our team. We'll be happy to answer. Thank you, Dr. Bhumika. Thank you, Dr. Kalyani. I think it was really great connecting back with both of you. And no, this is, I think, the objective what we had started. I think the students have been able to understand, and you know, uh, really great to connecting back with HMR. You're all alumni also, and this we'll keep on connecting back, circling back to you even for other requirements also. Uh, Thank you again. Thank you all for joining. Uh, Thank you.
Thank you,
Thank
Arun.
you,
Thank
sir,
you,
and
Akash sir.
thank you, IIHMR. Yeah,
Yeah, thank you.
Thank
Thank
you.
you.
Bhumika can go first, then I'll end my.
No, no, please wait. I have one
We'll take one group
announcement
photo.
to,
Yeah.
yeah, yeah. I have one announcement to make. So before that, thank you everyone who have joined today's insightful webinar on the growing opportunities in tech-driven healthcare careers. As healthcare professionals increasingly transitioning into technology-enabled roles, the future holds immense potential for innovation and impact in the industry. A special thank you to Dr. Akash, Dr. Kalyani, and Dr. Bhumika for sharing your valuable knowledge, experiences, and industry insights with all of us today. Your session was truly engaging, informative, as well as inspiring. We are confident that all the participants found the discussion very enriching. We also extend our sincere gratitude to all the participants who take their time to attend and actively engage in the session. And as we conclude today's webinar, we are excited to announce an exclusive application fee waiver offer to all the participants of today's session, and we request you to connect to our admissions team to know more about this special opportunity and take the next step towards your academic and professional journey. Thank you once again, and we look forward to staying connected with you. Have a great weekend ahead. Thank you so much.
Thank you,
Thank
Poonam. Yeah.
And thank you, Akash sir. It was really a wonderful discussion. This is my
Thank you.
first webinar, and I was able to discuss and get a lot of insight from Kalyani ma'am also, because she is a lot
Great.
of experienced in the industry. And thank you everyone for joining us today.
Thank you. Uh, Thank you.
Yeah,
Bye.
I will also
Yeah.
share a
Sorry, I
few
can
words,
have you. Yeah.
especially for Akash sir. Thank you for the opportunity and platform to talk. And thank you, IIHMR Bangalore. Honestly, from the bottom of my heart, that you've given a new, life to the or revive to the career that I was looking for. And yeah, great opportunity to talk to everyone here. Thank you.
Thank you, guys. Thank you. Thank you, everyone. I think Poonam will leave. Thank you.
Okay. Thank you, sir. Bye.